Nestlé provides you with tastier and healthier everyday choices to enhance your quality of life. Nestlé, good food, good life.
So if you've got a pain in your side, a weird rash on your arm, and a slight fever, what's the first thing you do? Head straight to the doctor, or head straight for the search engine on your phone or laptop? I sincerely hope it's the former. But more and more people admit to relying on information online in dealing with their healthcare questions or concerns. Now, discussing the pros and cons of digital diagnosis with me today are Dr. Darren Green, Dr. Tiaan van Zyl, and dietitian Nazneen Khan. Welcome to Doctor's Audience.
Thank you. Thanks.
So what exactly do we mean when we speak about digital diagnosis? We've got a little example to show you. Take a look.
Sore throat, and let's see, fatigue, headache, sore throat, strep throat, swollen glands, chronic fatigue syndrome. I feel a bit tired. Infectious mononucleosis. Oh my goodness. Epstein-Barr virus, West Nile virus, parasite, fatal illness. Please help.
When one Googles information pertaining to symptoms, the likelihood of getting an answer that's tailored exactly to what you could possibly have is quite slim. The list of diagnoses, the differential diagnoses that these programs usually give, are not ranked according to the most probable to least probable. And if you focus on some very unlikely diagnosis that could be potentially life-threatening, you will cause yourself a lot of unnecessary anxiety.
The problem is the layperson takes symptoms in isolation quite often, whereas one symptom can be part of a syndrome involving different systems of the body. And a simple one, and the easiest way to do this is to illustrate it. You take a symptom like dyspnea or shortness of breath. Now, the responses you could get from many different sites and algorithms could lead you down paths to take you to the lungs, it can take you to the heart, and then also a whole lot of other causes as well, even things like your acid pH levels of the blood being dehydrated from gastroenteritis, for example, or having too little hemoglobin. Your iron levels could be too low. So that's the problem. Nothing can really replace the looking, the touching, the feeling of the actual health professional examining and then having the insight and the knowledge to combine the information that you have. Knowledge is power, as Tiaan said, and it makes people so anxious. Almost the more knowledge they have without being able to sift through it, contain it, and direct it appropriately, that's what leads to the complications of what I call cyberchondria.
It also, yeah.
So how do you as health practitioners feel when you're confronted with a patient who tends to ask Dr. Google?
I often let them bring whatever it is that they think they've uncovered or discovered on Google or whichever other search engine. And then we go through the information. And although it's a little bit more time consuming, I think they feel that patient contact is just that much more worthwhile and that they've gone through the motions of eliminating what's been in the back of their mind, because people will believe what they want to believe in, inevitably. So it's usually a process of elimination, and then we explain exactly what might be happening. That works for me.
No, I think it's important for us to realize that this has come to stay, and doctors need to change their behavior within the consultation accordingly, and not be antagonistic.
Yes.
I do think sometimes some good can come of it, where a patient might remind you of something that you hadn't considered, however remote. Of course, if you're a good doctor, that wouldn't be the case, but sometimes, no one's infallible. And as she said, also not be antagonistic towards the patient, because they have gone to the effort now of doing that, which is actually wonderful, because we welcome behaviors in patients that can be beneficial to their health.
What are the positive aspects of technology?
Yeah, the flip side is actually true as well. So that means that practitioners are forced to keep up to date with the latest trends in medicine. And medical science in general. They're also forced to familiarize themselves with digital media. And then obviously the positive aspects are having an educated patient often decreases the amount of patients in your waiting room, Not all doctors want that. They want to be busy, often financially, but you've got to consider the fact that people don't all have access to healthcare. And also, when it's appropriate to eventually go to a practitioner is also something that people need to be educated on. And the online media does that. I think what our responsibility is as practitioners is to also share, educate, and empower our patients as to which sites are useful and which ones they should be a little bit more wary about believing.
It's actually quite easy to stay up to date. You just use up to date. So there's a website.
Yeah,
a very good one. Yeah.
But what's also helping so much these days are the apps. And I know in the nutrition and the fitness industry, the apps are especially valuable. It's just about, either scanning a barcode or even just typing in the product name, and it brings up the whole nutritional value, so you can actually keep track if you are calorie counting. Even if you just want to know what the ingredients are, what the food contains specifically, it's all about just clicking a little button on your telephone these days. So it's quite valuable, I think.
Now, while there's plenty of dodgy information on the internet, there are a number of reputable sources where you can find help. Take a look.
Here are some of the best healthcare websites you can access for information. WebMD provides a wealth of health information and tools for managing your health from an award-winning website, which is continuously reviewed for accuracy and timeliness. Health24.com is South Africa's leading consumer health website, providing world-class information and interactive tools for a healthy lifestyle. Finally, hospital groups such as Life, Netcare and Mediclinic also offer digital info hubs with articles on conditions, health and wellness. If all else fails, ask your doctor which website he or she would recommend to help equip you with the best knowledge.
So what are the final thoughts?
I think we need to harness the technology, and I think we need to use it to our benefit. There's so many different types. We could Skype our patients, we could send them emails. It's not just about that patient contact in your rooms. And like Dr. Van Zyl said just now, it's here to stay.
I think it is important for the public to realize that doctors train for quite a number of years, and one would hope not in vain. I don't think that technology has replaced the doctor yet. However, technology is definitely bettering itself. We need to adapt to that. The other thing that I would also like to say is when the public see things quoted online like a study says or studies have shown, this does not necessarily mean that it's the truth. And that is also part of the role of the doctor to determine whether these things are indeed of use
which
or not. Because studies can be flawed, studies are not necessarily credible. And we are taught how to interpret these studies correctly and to make an informed decision whether or not one should act on it or not, which is typically a very long process. Medical practice does not change overnight because of one study. And that is also, I think, a very important thing for people to realize when they encounter these things online. But yeah, it is here to stay.
So I think comfort zone is a big one for me. We need to understand our boundaries in our practices as to how much freedom we give our patients to come to our practice and share their questions and knowledge, but also with that, obviously, guide them with true authority in doing good and not harm. Finding that balance as a practitioner, I think, is a big responsibility, and we have help in doing that. I think that we need to keep up to date with the latest in terms of IT, but also in terms of which sites and which reviews are reliable. The good peer-reviewed journals need to be utilized. And we also owe it to our patients to educate them in terms of preventative health and health promotion, and not only doing crisis management all the time.
Thank you so much, everyone, for sharing your insights. You might think it's quicker, easier, and cheaper to seek help and information online. However, misdiagnosis, incorrect self-medication, or waiting too long to seek proper medical attention can all cost you far more in the long run. So, don't discredit the human element of healthcare just yet.
Nestle provides you with tastier and healthier everyday choices to enhance your quality of life. Nestle, good food, good life.